very exciting 2 days, especially to work with all our applicants, with the AIOS, with a lot of jury and the industry partners. I think slowly we are making an impact in this direction, where India is doing well on patient care, education and research. This is one area probably we should leap in the coming years. So I'm going to talk about the incubation ecosystem. For us, the most important ecosystem is LVPEI itself, allowing this with the group of engineers and the clinicians and working together and making our own products. As Dr. Rao said, it's a decade-old service or a functional arm we have created. But in the last 10 years, we have progressed. We have progressed into an area where beyond LVPEI, how can we help the community of eye care professionals? That's why this ecosystem has come. And Hyderabad, as you all know, is special in this process. If you look at innovation, innovation is itself is a cycle where at the center there is an idea, and then there is a company, and of course there is funding, and the most important thing what you're looking at is the customer. Unless you make or that point is the most important thing, your process will not be complete. And working for the last decade or so very closely, what we have realized is the most important is the passion. If you have that in you, come what may, I will bring that product into fruition one day. That's the most important. And even in our own experience, that really drives these two things which are highlighted. It drives the product. Having said that, I'm just giving some update. Just 3-4 years ago, you know BIRAC. BIRAC is for Biotechnology Industry Research Assistance Council. And they fund. We took the grant from there and we created this BioNest Incubator. BioNest, the full form is Bio Incubator, nurturing entrepreneurship for scaling technology. That's the purpose of whatever BioNest in the country is available, and this is one of those, and most of you have visited this facility yesterday. What are we trying to do is make in India. The government of India has begun with that approach that in the last 9 or 10 years, want to make it as much as possible in our own country. This has got, as I said yesterday, all the requirement for designing, prototyping, probably validation, and the last two parts. We have an excellent team of engineers of all streams, support staff, grant managers, and obviously ophthalmologists, optometrists, and administrators. They all form this ecosystem where I can go to an engineer and any of the clinician or any of the administrator can go to them. Probably this is my problem statement. We would like to, and there will be an internal discussion, and then we look at the value of that and then go forward with the product. And this is the ecosystem. We have a group of people who take care of on the administration side. Fortunately, with our pyramidal system, we have an excellent group of clinical mentors for any of the product you talk about in eye care. And with Satguru's team, we also have a tech transfer office with all the requirement for your IP needs. For any products, even if there is IP is there or not, they will do a very initial search and tell you, this is already open, this is open source, this you can apply, what portion of IP you can apply for where, everything is being provided. So it's been of a great help for us having this TTO inside LVPEI. Dr. Garg showed the people who are incubated with us. You can see the list of people, and always the ecosystem is complete with the partners around Hyderabad, in the country, and we have people mentoring from beyond India as well. And this is the group of partners what we have. One thing very, very important in this journey is to have industry partners. As said earlier, it's not only the clinician, it's not only the engineers, it's the whole ecosystem, including the industry, is very important to bring about that product or scalability wherever it is. As a prototype and clinical validation expert, we also collaborate with the industry partners for different products. We have much more industry partners than this, what I have shown here, so that we can scale the product to the higher level, and we will have more of a productivity capacity with these kind of partnerships. These are some of the events where we connect with the Hyderabad or India ecosystem. Probably on an alternate month or quarterly, we connect. We discuss of various requirements, including regulatory, IP, and everything related to a product development. Just wanted to give an update. Last year, this is the second year we are having this startup challenge. Just wanted to give what happened to the last year's winners. Just wanted to share few graduation or progress they have made since they joined us. This is one of the startup, NeuroSim. It's a virtual reality based therapy for amblyopia. It's a gaming. With that, they have come up with this clinical validation process. Dr. Vivek Worker, he is mentoring them in terms of product improvement. With 4 of our tertiary centers, we have started a clinical validation so that we are comparing this mode of therapy for amblyopia, because as we are in 2024, there are many software-based treatment for amblyopia. But there is something special here, which is a game-based. Whenever there is a game, the kids' adaptability becomes better. So that's been going on. We have already started recruiting. We made some changes in the prototype, and then we have. And most importantly, within 3 months of incubating, Rich, it's one of the network partners we have, and the T-Hub, they kind of gave 45 lakhs to this startup so that they can go to the next level very immediately. So that's one thing happened with NeuroSim. The second thing is alien innovation. The innovator is here, already sitting. So we help them in these aspects of product testing at our rehabilitation, mentorship with experts from the rehabilitation, and technical mentorship, and they were the runner-up, so they got 6 months of free incubation at LVPEI Bionest. They have moved on. Now they have come up with this kind of torch where the blind people can really see what is the obstruction. We were thinking it's at 1 meter or 2 meter, even at as less as 10 centimeter or 5 centimeter. It can tell you by vibration there is something. So instead of using a stick, they can use this torch-like thing. Now we not. So that's where they launched this on a World Braille Day recently. So that's the progress they have made. Binox is another incubator with us. Again, Dr. Virendra Sachdeva, they were already a mid-stage startup when they joined, but they wanted again a large number of clinical trials. Virendra Sachdeva has taken up, and we have done the randomized clinical trial. It's ongoing, and there also guidance was given on the new product development, and they are also connected to other startups. The last one I just wanted to talk about is one of the startups who joined us, who is incubated with us, Core Idea Innovation from Chennai. very novel idea of televisual acuity estimation and telerefraction. Both the things are the most difficult thing to do in ophthalmology. So again, they got the seed grant as soon as they incubated with us. With this, Ms. Maheshwari, she's reached a stage where she has a prototype, and she also have, with Satguru's team, she's already applied for patent and she's making stride. Why am I showing this? Because this journey is not 2 months, 1 month, or 6 months. It's a process. You have to be persistent with that, but you need to go through everything. Then only you can come up with a novel product which is scalable. Artelius is the last one. This has a very low cost OCT, which is the most needed thing for India. You can see the comparison between that and here. And they also have a fundus camera, which is connected to AI. Dr. Mudit Tyagi and Dr. Rajiv are mentoring this company. Again, they are making some strides. At this point of time, they have a requirement of close to 50 or 60 instruments for all over India. They are in a raising fund stage at this point of time after incorporating all the new ideas for this. That's the very brief thing I just wanted to tell you about what exactly happened in the last 10 or 11 months. It's actually 10 months from since they incubated with us. I just can't stop talking about our own CFTI because that's number one is, that's the way I show gratitude to our team, and that's the way I feel how proud I am about their team efforts. So our vision is very simple, but it's difficult. To bridge the gaps in technology solutions for eye care. It can be for India, it can be for other LMICs, or it can be for the world. With one thing in mind, that is C2C, concept to community. Because we are fortunate to have philanthropists who are very readily agreeing to fund us. You know, we are able to take this stride with our engineers and our eye care professionals to take it forward. Some of the products, I'm not going to talk about what is this product because we have already heard about it, but just two things I want to talk. Number one, myopia, you can see everywhere in the world, it's on the rise. Because at this point of time, we have at least 16 or 17 interventions to halt the progression of myopia. Some of them are pharmacological, some of them are optical, some of them are kind of light therapy and things like that. In that way, our team of myopia center team, along with a bunch of interns who have joined, the first task was they developed a calculator for a myopia progression risk. Parents can enter it, and with this app, then they can come up with an answer whether the child is low risk, mild risk, moderate risk, or high risk. Very simple, very elegant from our interns led by our engineers. Second thing I want to talk about is this is an open auto refractor available. You will not see many of those in the country or around the world because it's pretty expensive to the tune of probably 20 lakhs at this point of time. But this is an important tool to estimate the peripheral refraction in children with myopia because that is one of the guiding force whether to go into pharmaceutical or optical treatment. Again, our group of engineers made this simplified peripheral ancillary refraction component where you can see here 22 degrees here and 22 degrees temporally. With just clipping this onto your trial frame, you can do peripheral refraction. This is the frugal innovation. Our guys have done it. And with this, what happens? Anywhere, any solo practitioner, either an ophthalmologist or optometrist, don't have to depend on this heavy or expensive instruments. In their office, this is almost launched. I think people can purchase this. It's pretty easily available so that customized myopia care can be provided to everybody. The second thing I just wanted to talk about is the pediatric perimeter. There are no perimeters available for babies. This is with the Prem Nandini and the team. This is a patient with congenital glaucoma. You can see a very large cornea, trying to do a visual field. It can be applied for cerebral visual impairment children. We are calling it as from pediatric perimeter to BAVIS. Why did we change? It's a baby vision screener. It's a journey, you can see, perimeter to the baby screener. 2,500 plus babies we have done this test. But over a period of time, can you play the video if possible? Yeah. This is one of the patients with congenital cataract just before surgery. Second video, please. Patient is crying because the child cannot see much things with the total cataract there. Second thing, on the post-operative picture, the first post-op, you can see the fixation, how it is improved. Third video, please. This is after 1 month. You can see vision has improved, the fixation has improved. Why am I showing this is, you can also see that the strabismus has almost gone there. For a